like it's orange. Y'all, I'm trying something, so if you happen to pop on while I'm trying this, don't freak out. I'm just trying to see which camera I'm gonna use. And I think I'm gonna use that camera. All right, Sharers. I'm on, Mom. I'm on. I am on. Okay. Okay. Hello. Hi. Hey, TJ. Hey, Miss Dora. Hey, Kay. All right, so I need to share this. Copy. Just sharing, guys. Give me 1 second here. We're not starting into a couple of in about 2 minutes. And just gotta share this with the world. Well, at least I thought I was gonna share it. Hold on, I just passed somebody. Michelle. Issue. Nope, that's not the person. Okay, no. No. Okay. All right. Okay. Yeah, I'll just put it right there. Hey, Aaron. Hey, Michelle. Hey, Jalissa. Hey, Miss Sherry. I had to turn my camera around. Yeah, it looks clear with the back camera, so I'm glad that I have my other phone here, so that I can see what I'm doing. But yeah, so hold on, let me see. I like this camera better, but I'm going to try the other one. Hey, Corgi. Hey, Lynn. Let's see. Yeah, I know the back camera has a higher resolution, but even on my iPhone, my front camera was a little bit better than this one, so I gotta see. I'm finna see. Uh, might be alright. I don't think so. I guess I'm gonna find out since I'm not close to the camera. Okay, it looks a little better. Because last time I did, it was like fuzzy. So, alright. Yeah, send me. I was gonna send it to you. But yeah, please send me a private message, and I will most definitely get it back over to you. I hope you guys had a nice Thanksgiving. That's the reason I didn't do Fierce Friday last Friday due to Thanksgiving and whatnot. I might want to bring this up some. I didn't see that. Ugh. Do that like that. Oh, that's fine, Lynn. You gotta do what you gotta do, sweetheart. But thank you guys for tuning in to another great episode of Multiples. Sclerosis Monday. You gotta say it right. Multiple Sclerosis Monday. If you don't say it right, something's wrong with you. You should already know how this goes. You've watched it long enough to know. But today I don't really have bullet points. I have a number of things. Let's see, 1, 2, 3. Well, I guess you can consider them bullet points to a sense because there's 3 things. Might be 2. I might have to figure out how to say this word. I'm about to type this in and figure out how to say this word because I don't want to say it incorrectly. But it was the 3 things that I come across on this website, and I myself, hey Miss Elizabeth, I've gone through this repeatedly myself since I've been diagnosed. I can actually own up to, I want to say here recently in a few months, off and on, I've dealt with a little depressed. Being depressed, more or less kind of let down with myself. Okay, Ms. Lynn, because of something that I preach about a lot that we have to stay away from. And that's the ideal of letting go of the past and just grabbing hold of the past and staying in it. We have a tendency of doing it a lot, and it brings, with me personally, when I get stressed out, I have a lot of, or get depressed, I start spasming a lot. I know this, and because I know this, it's not something that I go and call the doctor and be like, oh my God, spasming like crazy. I just know myself that I need to just calm down. And it's very hard to say. And, Jalissa had said this to me, it's easier said than done. So I know a lot of stuff that I ask you guys to do, or to advice that I give to a lot of you all, and even advice that you give to me or you all give to other people. Hey, Marie, you have to realize that it is easier said than done, that we're not all alike per se when it comes down to dealing with stuff. And I hear us talking about it and telling everyone how depressed, how upset, how angry we are at life in general, or people. Quote unquote, a lot of us are angry with, God. And so we're just depressed, very, very depressed. Wondering, how did we end up with MS? Why do we have MS? And so we asking all these questions that people don't really have answers for. I'm gonna be honest with you. Me doing I Can Beat MS and talking to you all, I have come across more answers than I have going into the doctor's office. And I'm just gonna be honest with you. And so again, that's why I push this more than anything, and I try not to miss any days if I don't have to. And yeah, Miss Carrie, and it's nothing wrong. It's nothing wrong with missing the old you, but what you have to realize that there is, hey, Missy, there is a new you. That's a new you. And you have to find some type of balance in this. Not saying that you have to accept. When you accept that, oh, I'm in a wheelchair, oh, I'm bedbound, oh, I can't walk correctly. Hey, Felicia. You can't get stuck on that, because once you start getting stuck on that, you stop realizing that there is a chance that, one, you might be out of a wheelchair. Hey, Mark, you just might be walking again. The new you suck. I think everybody can vouch for, at some point, the new them did suck. Um, Kay, what you really have to look at is, and when I go back to finding that balance, you have to find a way, because you're going to hear this all the time, and it's just to the point that while we even, I'm not saying that we shouldn't be hopeful, but the more that we worry about if there ever going to be a cure, the more that we focus on, hey, Miss Lawrence, the more that we focus on, hey, Miss Scott, you went past me there. Thank you, Jalissa, for saying hello to Miss Scott. Um, the more that we worry about if there will and whenever there going to be a cure, the more that we're gonna just forget the fact that we can live with MS. And the fact that you're accepting again, it's not that you wanting to accept, but when you start living while you're diagnosed with MS and finding a way to live while you've been diagnosed with MS, it's not that you're accepting and you're losing. What you're doing is you're trying to win. The more you harp on the fact that you don't have the old you anymore, it's the worst that you're going to ever be off. You're shutting yourself down, basically. And it's funny that I say that. Miss Sherry was saying that let's see, I'm guessing somebody. Hey, Corey. Somebody said something, but Miss Sherry was like, you can't manage him being depressed yet to find your happy spot. Well, you have to find your happy spot. Basically, what she's stating, and concentrate on things that you can do. And that's the point. You have to concentrate on things that you can do, not what you can't do anymore. Because the more that you realize that, dang, and when I say realize, because you put it in your head, I'm not going to be able to walk anymore. That means I can't do anything. That's not true whatsoever. Even if the doctor comes and tell you that you're going to be paralyzed for the rest of your life, that doesn't mean that you can't do anything. It may mean that you have to have help. That's the last thing that you're wanting. Yes, I totally understand that. But that doesn't mean that you can't do anything. That still doesn't mean that you can't live your life. That's where that mental toughness comes in. And that's with anybody, even with myself. Even though I can walk, even though I can move better than Miss Sherry, but still at times I get punched in the face about things that I can't do, and I just have to sit back and start breathing and like, okay, yeah, I can't do that, or I'm not able to do that, but that doesn't mean that I can't do something else. So let me gravitate to what I can do. Let me make what I can do a happy place for me. Let me try and get good with that, even if it's something that I've never tried before in my life. And so, but that brings that mental health is out there. And there's nothing wrong with going to talk to someone. And a lot of men, the women will go out and have a counselor before a man will sit and say something's wrong with me mentally. I'm not all there, because especially with MS, I'm not all there. Heck, a lot of men won't even talk to their spouse, their partners. And so, men, if you are listening to this, I gotta make sure I share this. But men, if you're listening to this, there's nothing wrong, especially if you're married, pulling over your wife and saying, hey, I need help. I need to talk to someone. Hey, Rob. Hey, Mario. Hey, Miss Delise. So you can't Ms. Lawrence says it's hard, but we must focus on what we can do and enjoy the life we have. It's a daily struggle, but we need to attempt to make adjustments. That is so right. We have to try to make adjustments in our everyday life. Yeah, Miss Scott, it does. It mentally it sucks. It can suck like on a daily basis. But we do have control over that. Do not tell yourself that you can't control if something sucks or not. And I hate to say this, but it's almost like us staying in a relationship that we're getting abused. We choose to stay in a relationship, or we choose to sit up here and say that not even a relationship that we're getting abused. Heck, it could be just a family member that sit and put us down on a repeated basis and that talks bad. And the only thing that we can sit and tell everybody, oh, they love me. That's the reason why they're doing it. If you want to look at MS like that, it's an abusive relationship. MS is a very abusive relationship. It talks down to you. It mistreats you. It trips you. It has you in the bed all the time. Sometimes it stops you from eating. It won't help you clean yourself. So you're in an abusive relationship. And what do you have to do in an abusive relationship? You have to understand your worth and who you are at this point. So if we're sitting up here and saying MS is an abusive person to us, then, not saying that we have to ignore it because it's there, but then we have to find something in ourselves as of right now. We have to realize, yes, I am in this wheelchair. Yes, I am using this walker. But guess what? Women, if you want to say this, I'm the sexiest person alive with a walker. Heck, I don't know if you guys know Jasmine, Miss Jazz. She makes a lot of jewelry. I told her to bedazzle that darn walker. Even tell you, bedazzle the walker, the wheelchair, paint that thing, do something, make yourself feel good about what you're doing. Just like Miss Sherry. Miss Sherry, if you have to, girl, you do that. Well, Miss Sherry already is on level 10 with her confidence and I'm pretty sure she still has her downtime, but she's like the most optimistic person I ever known. Yeah, some places do have sliding scales. That is a good question. What if you don't have what if you don't have insurance? The MS Society is a joke. MS Society can be a joke when it comes down to stuff like that. You are totally correct. I feel that way. And like Ms. Lawrence was saying about the sliding scales, depending on how much you're bringing in, some counselors do have a sliding scale. So that's something that you could think about looking into. Felicia say she ain't no punk. You ain't no punk. You ain't no punk, Felicia. You ain't no punk, girl. Ms. Sherry says, try to deal with MS and a phantom pain where you think the foot is still there. Exactly. Like Ms. Sherry's saying, all right, let's say it like this. I know everybody has their limits, but if you feel that you're going down, think about Miss Sherry. Miss Sherry could be a poster girl of just, dude, I'm done. But she keeps trucking. She keeps pushing. Because to a degree, she knows the more that I worry about the fact that my leg just got cut off, the fact that I'm paralyzed, that means I can't live any type of life, any type of normalcy. Yeah, who wants to call this a normal? I get that too. But still, the more that you sit and you soak in it, you're going to drive yourself crazy. Not only that, do you not understand that a lot of us MS warriors are the reasons why we might be in a crazy relationship with a partner as well, because now we're so bitter inside that we might be taking it out on someone else. I've heard that a lot throughout a lot of the groups that we're in. And I've also heard the opposite, where that person used to be a prick or bitchy, that they're not bitchy anymore. And so I don't know if that comes from the humblingness of what MS does to you. You end up humbling yourself. I'm not sure if that's the case. But yeah, you and MS Clinic are two different things. Oh, MS Clinic. The least I'm not sure if we even got one here. That's something to look into. Yeah. Let's see. Hey Terry, how are you, sweetie? Yeah, it was, wasn't it, Felicia? I'm just looking at the comments, guys. Wow, there's only 2 in Canada? Huh. But going across this website, it says multiple sclerosis affects everyone differently. If you and your loved ones or your loved ones have MS, you are probably familiar with the symptoms such as difficulty walking, fatigue, and numbness or tingling. These are other physical symptoms. These and other physical symptoms can be severe and limited. However, emotional changes and mental health changes can be just as disabling. So, exactly what I was finna get to. Going back to Miss Sherry. Miss Sherry is paralyzed. Okay? Then also Miss Sherry has her leg gone. She has to have people to lift her. Then you take me, for instance. It's a lot of us that can walk. It's a lot of us that are using walkers or using canes. But we permanently can disable ourselves even worse than what we are, because we're too focused on the fact that we can't run like we did last year. Or we got a limp in our step. Or we're having to wear a patch over one of our eyes, and we're worried about what somebody else in the world is going to say to us. We're worried about if people are going to judge us. And you know what I say, me personally, what I say about that, I can't remember if I've said this a lot, but I tell people to judge me now. I welcome the judgment. Judge me all day. Because at the end of the day, I know what I'm doing and I know what I'm not doing. And if you call me on something that I'm not doing, then I realize that, then awesome. Thank you. You're teaching me something. But outside of that, you can't judge me. Regardless if you feel that you are, you can't judge me. That's what we have to. And this goes way beyond MS, being diagnosed with MS. This is everyday life in general. Because people don't like to be judged. I don't like you judging me. Hey, Kim. So, the first bullet point. Exactly, Terry. You can't care. If anything, come over here and talk to me. Come over and ask me what's wrong with me. You know what? Matter of fact, when people come to work, when I'm at work and I'm at the cash register and someone has a cane, someone has a walker, someone has a limp, I ask, hey, if you don't mind, I'm respectful about it. If you don't mind me asking, why are you limping? Why are you holding your arm like this? Why do you have a cane? And I've learned so much about people, because I don't want to sit there and be dumb and say, and just assume something, because that's what a lot of people do, especially when it comes down to us. They assume, and they always, and I just actually came across last week another MS warrior, and it was just so cool because when she was at the register just doing this, and Kim says, I forgot it's 6 p.m. my time for live chat. Oh, Miss Kim, if you need to go, you can go. And Corgie said he acts all the time. Miss Sherry says she does that. But she was just basically shaking, and I asked her how her day was, and she was like, "I'm okay, but I don't know if you could tell, my multiple sclerosis is bothering me real bad, and I'm having a bad day with my MS." And I looked there and I was like, "It's funny that you say that." I said, because I have MS as well. I've been diagnosed with MS as well. And her eyes got big, and it was like, she kind of threw me back a little bit, because she was like, "Oh my God, I'm so glad to see somebody walking and working. And I'm so happy." And I really didn't know what to say after that, but she shook my hand and whatnot, and I told her about the group and whatnot, and I gave her my information. I'm not sure if she's gonna call me, but the information is there. Maybe she will, maybe she won't. But it was just the fact that she was walking herself as well, but she just still had jitters, the shakes, and it could be some other stuff going on with her as well. But I could tell that she was kind of depressed and whatnot, and I was just trying to talk to her, and it was just so happened she had MS, and so that was a good thing. But she left with a smile on her face. We had a little brief conversation and whatnot, and the fact that she left with a smile on her face, I thought that was cool and whatnot. But let's see. Who did this? Who you virtually hugging, Mario? I gotta watch you, Mario. Oh, you like the shirt? Yeah. This is me beating MS. I can beat MS because I'm cutting through it. Yeah, it's pretty cool. And designed it myself. I made it. Okay, I didn't make the font. Hey, Miss Kathy, I put this together in order to make it come through this. But Miss Felicia says, I asked this lady this last weekend why she was in a wheelchair. She had one leg and told me about a motorcycle accident she had had. She then went on to envy me because I could walk. It humbled me, and I hadn't even told her yet that I have MS and was bitching because I couldn't run. Exactly. Mario, you always doing something. I see you. It's backwards because of how I'm looking in the camera. And so, no, it is backwards. More I think about it now. Huh. So, if you're looking at it this way, ha, ha, ha. I always wondered that. Wait, hold on. No, because if you're looking at it this way, you're gonna. I don't know. Corey, man, you got me going crazy, bro, because I'm sitting up here thinking, yeah. But Felicia, and that's what I was trying to get to. Guys, if you sit and you're thinking that, oh damn, my life is miserable, think about Miss Sherry. Miss Sherry just had to get her leg cut off. You think Miss Sherry wanted that? Who would want that, regardless if you're paralyzed or not? Who would want to look down and see that their leg is gone? And, so you really have to take take in what you're able to do, because there's always a warrior out there that's worse off than you. And now, this is not taking away from people that are just becoming first diagnosed, because when you become first diagnosed, that is something totally different. That's totally different. It's a different animal, because now you're first faced with the fact that you got MS and you don't know what the freak can do about it. So when somebody adjusting off of something like that, then I can most definitely understand that you're sitting and you're trying to figure out why, what's going on, why me, and all this question. But then as years and months and weeks go by, people tell you not to do too much research. I agree with that. Don't do too much research when it comes down to finding out what MS is going to do to you. When you're researching, research something that's going to make your situation better. Look at what you need to do to better attack MS. Because the first thing that they talk about is depression. They basically stated on this website that depression can occur in up to 50% of MS patients, and is 3 times more common than in the general population. Up to 40% of the support partners, such as a caregiver and spouses, may also experience depression. Mario talked about this a lot, about his relationship with his wife, and I really want to hit on this Friday. On the emotional part of I Can Beat MS, I want to hit on this Friday. I'm hoping, I put a post out where I'm hoping caregivers or spouses or partners will come up and or want to watch it, and we can have a deep conversation about the other side of MS, because a lot of us have partners. A lot of us are pricks to our partners. A lot of us might even be the reason why some of our partners left, because they couldn't deal with it. And we might not be saying that because we're dealing with MS, not them. So I like they nerve. What? You leaving me? You don't want to put up with me? You don't want to put up with me because I got MS? You have to really think about it. Are you being a prick about it? And I'm not saying that's the case for everybody. We just have some people that like, I just can't do it. I can't love you anymore because you're not the same. I hate that as well. But you can't just be mad at the world. And this person is trying to stick beside you, trying their best, and especially if they don't understand. The best thing I can say that, not the best thing, a lot of the great things that I got from out of making this is I've had a lot of couples. Matter of fact, I had 2 men that have come to me and stated I had the slightest idea what was going on with my wife. And I was in a group that she's in, and I came across your live, and it opened my eyes and changed a lot of stuff. And so to hear that kind of took me back as well. That kind of make me want to, it actually did make me kind of tear up, but it still made me happy, the fact that now you're being able to understand. I gave a little something so that you can realize that your wife is not the only one out there. So let's see. Koji, you're right. It's not a no, it's not a competition whatsoever. It's not a competition. And Miss Sherry, you found out about your older sister. Yeah, I found out about MS from caregiving my kid's grandma when I was in my early 20s. That's the first time I found out about it. And then my sister got diagnosed. And then here's my crazy. I guess I'm just jealous of everybody and want to go get diagnosed myself. You cried and soaked for days when you first learned out about MS. I'm sorry, Miss Lawrence. Hey, Nancy. Yeah, when you first get diagnosed, you get put in a real bad place. And the doctor sit up here telling you, I ain't no cure for this stuff, man. You gonna die. To listen though about that. That's what they basically told her when she was young. you're gonna die. Well, she wasn't young. She was young, fairly young, but like not a child. Yeah. Mario, welcome to the club. You won't be there for long. Nah. You can, any one of us can fight this. Any one of us can beat this. We are. And I might be overstepping, and people might look at me kind of crazy if they hear me saying this. I'm gonna say it anyway. I feel that we are the cure. We are going to be the one to cure ourselves. It's not going to be any medication. Because think about this. All medications that come and quote unquote says that they're a cure, how many effects do we end up having outside of this so-called cure? Matter of fact, think about cancer. Think about the medication that we're on. We sit up here and we take this so-called medication cure. Let's sit. All right. So let me ask this question, and I'm gonna get back on topic. I just want to ask this question: what happens if the doctor comes and tells us that you can either keep doing what you're doing with your MS, or I can give you this cure? Now, this cure that I give you, that it shows that there's records of people being cured of MS. We have all these people, videos of people saying, I'm cured of MS, my lesions are gone. But there's more side effects. Kills your liver. You have to end up getting, what is that? Dialysis. You got to go to dialysis. It affects your lungs. It's possible to get blind. So, what would you choose? To continue to live your life with what you're doing right now, living your best life with MS and battling it the way that you're battling it, or get this cure that the doctor is trying to give you? That's the question that you really need to, and it's just my opinion in itself, and I know that we have breakthroughs throughout the years, but I really don't personally see a medical breakthrough outside of an operation that's going to sit up and go in your brain and put coating around your nerves, which that can be an issue as well. But putting coating around your nerves, allowing your nerves to start communicating correctly, and you be okay. But you really can't say anything about that because depending on the doctor that's doing it, that's a tricky situation as well. So that's the question you need to ask yourself. Am I willing to take? But let's see. As Lauren says, her ex left her when she was diagnosed. At least he made up he made up a lame excuse. Yeah, Jalissa said she was 22, so I was kind of right. I was a little young. Kim says, my partner left because MS. He just wanted to take care of himself, but he didn't help me. He went with me to the doctor twice, so it's just me, no partner, no caretakers, just all of you. I think it's a lot of us in a group like that. Kim, so yes, don't feel too bad. Kim said, I freaked out and went in panic mode and researched everything. And I think that's something that we all, a lot of us, let me say a lot of us did. And when we researched the MS, we looked at more of the bad things than what you could possibly do still living with MS. A lot of us don't research that part of MS. What can we do? Is there any good sides of MS? It's so much out there being negative, which I'm not saying that is not the case, because MS can be a very disabling disease, illness, diagnosis. So it is good to know that ahead of time, but then at the same token, especially if you're not witnessing that or being pushed to that limit, worrying about it can get you there faster than MS can. I'm just be honest with you. Being in a stressful situation where you're depressed, where anxiety attacks you, that can put you in a flare up way faster than you having an MS symptom in itself. Being depressed and having a flare up and having an attack, freaking out, can send you in a flare up, can have your symptoms of MS acting up. And so that's one reason why I wanted to hit on this mental thing. You have to try to find out how to cope with everyday living, regardless if it's on MS or even just your partner, your kids. I allowed myself to get a little ruffled this weekend. And for me getting ruffled, boy, I was shaking and spasming, and the only reason why I was shaking because I was just trying to control myself, because it had the situation poked me, and it poked a button that I don't really like to be poked, and in order for me to confine it and to hold it in, it was hard. And so I was focusing, and it just kind of overwhelmed me. And after the phone call, my spasming was crazy. It was ridiculous. It wasn't comfortable at all. And it took me, I want to say, at least about 4 to 5 hours to get control of my of my feelings, to calm myself down, because I felt so strong and passionate about what was happening. Let's see. Yeah, you're right, Kay. They prey on us a lot, and they're pocketing money like crazy. But you can find some doctors, that are really trying to help, and you just you have to, if your doctor doesn't want to listen to you and is just telling you to take this, you better take this, you better take this, you need to run to the hills. That's the wrong type of doctor to have. If a doctor's not going to listen to you, if a doctor's not going to, regardless if you die, hoping that doesn't happen, but if you tell your doctor that you don't want to take it, and if it is a cure and you don't want to take it, your doctor still has to listen to you because you're the one paying the money. But if a doctor sits and forces you down, or threatens you, you better take it, or such and such, you don't need to be with that doctor. You can really tell if a doctor cares. I haven't heard or come across anyone, regardless if they have an illness or not, can tell if a doctor cares or not. Because they're going to tell you that they like their doctor. Oh, I love my doctor. I love my doctor. If somebody sit up here and they don't say nothing about loving their doctor, then they just going to the doctor, pretty much. I'm laughing at you, Kay, that you don't remember typing that. I have that problem. Sometimes I leave out a whole paragraph. Ask Jalissa. She be looking at me like, huh? She be texting by, what? What did you say? Yeah, Kim, you can't feel bad. Hey, Jessica, how are you? I didn't see you come through. I do apologize. And that's good, Miss Lawrence. 29, and you've been pushing. Um, Kay's been diagnosed when she was 24. I was 31, but still. Like I stated in the last live, that we were born with this. This was a situation that we were born with, and the stuff that we've gone through in our life, stuff that we've eaten, the stuff that we've been subjected to, whether it's environmental, mental or physical trauma, stress, our everyday lives has basically activated this. And so a lot of us are trying to figure out, why did I get this and how did I get this? This is something that we've always had. We've always had this. What we need to start thinking about is, what did I do? What happened to me to have this activate when it did? Because it's always been there. If I would have known the reason why I was clumsy had something to do with, I had something going on with me in the inside, the reason why I couldn't stay off the floor, the reason why I was tripping myself, the reason why I was falling all the time, the reason why I was becoming paralyzed sometimes, the reason why I was having seizures. A lot of that came, I activated my own MS. I know I am the culprit for the reason for my MS being activated, because of my emotions, me being passionate about other people and caring too much. Got me to where I am now, but also has also gotten me to where I am now because I care. But I don't care in that way that I was caring, that I wanted to commit suicide, that I had nervous breakdowns, which pretty much my MS just, I had to flare up, and it was because of my mental breakdown. It was coming. I'm gonna be honest with you. I've been having mental breakdowns ever since I was about 13. And that's when my life started changing. So you have to really sit down. You have to dissect yourself. You have to look. When people can't stand going back. All right. Check this out. People are talking about, I miss my old self. But go back and look at your old self. And look at what your old self used to do. Look at what your old self went through. Look at what you put your old self through mentally. Some of those things that you might not want to talk about, some of those things that you might not want to discuss with others, with yourself, with your kids, with your partners, with a counselor, may be the reason why you are sitting in the hot seat that you're sitting in with MS. Just food for thought. Food for thought. Nobody's telling us this. Why do you think the doctor says, tell me about your life? I'm diagnosing you today, but give me a little bit about yourself. And if the doctor that you're talking to is keen on MS, they're going to sit and tell you, more likely, you could have got diagnosed back when this happened. And a lot of us are not looking at that. A lot of us are not looking at the fact that I used to be depressed back when I was 9 years old, or I was in an abusive family when I was younger, which basically had me depressed, had me having anxiety. Felicia, not seeing anyone's comment? And Ms. Lawrence, yeah, you have to find a stress-free vibes. You're really not going to find it. I'm going to say it like this. It's very hard nowadays because of how crazy people can get. But still, even with people being jackbutts, you still have to find some type of balance. You have to let some of that stuff roll off, and you have to go on about your day. Yeah, Mario, you have to get away from trying to being upset, because it can set you back. It can set you back a lot. On top of the freaking weather already having this day with us, and then we get upset. Then that us getting upset, a flare up, man, that could be some serious damage. Yeah, if you're not seeing comments, sometimes you're not. That means that you're not in the live feed. So you're right about that, Jalissa. Oh, then sometimes if you press the screen where it'll the comments will leave sometimes depending on where you're at. But you say you can see now. So Jessica says she had her doctor that she the whole 18 years. I had my doctor the whole 18 years, and she stated they had MS. Wow, that's weird. To be diagnosed by a doctor that you've had for so long, and I guess it's kind of good though, because then they kind of maybe they saw it. Yeah, it's a lot of. I actually at one point, Jalissa got diagnosed with PTSD. I was taking medication for it. I don't know right now though. Vicky, yes, I have, Felicia. It's been a couple of days. I had to call and check on her. She had to step away from the group. She had some stuff going on. She had to step away from the group. And I'm glad that you brought the name up. I do need to check up on her. All right, Rob. We appreciate you watching. No, Ms. Lawrence, I didn't. I wasn't told that I was falling because I wanted attention. I was told that I was having a nervous breakdown because I wanted attention. I was most definitely told that. With the situation that I was in, the reason why I had a nervous breakdown was because I was looking for attention from a particular person, and it wasn't I was looking for attention. I like literally had a breakdown due to the fact that I did not believe that this was happening. Definitely after I told somebody that it was finna happen and it was gonna happen, I saw it. And if you guys don't know, I've told this story a lot, that especially before I got diagnosed, I used to have visions of things, and I visioned this issue, this situation was coming 5 years in the future from when I saw it, and I told this person that it was going to happen, and this person knows that I saw things, and they believed in me seeing things. It was like evidence have been there to where the stuff that I see, it was happening, right? So they quote unquote took the precautions of doing what I had told them to do to find out about the situation, and they told me that the situation wasn't going to happen. It had been crushed. So, but the situation did happen. And the way that the situation happened, like to the T, and the fact that I knew that it was going to happen, and I told myself, and I listened to the person and believed the person, it broke me. I mean, it broke me in half. Bad. Oh, it was bad days for me. It wasn't good whatsoever. Okay, Felicia. Yeah, that's good. I'm gonna check on her too still. See. No, Corgie, she's not on Facebook anymore. Not right now, anyway. She's not on Facebook, guys. Yeah, they are. They're very much real. I don't have them as much. I really think the fact because of um my nerves misfiring that I could be I could be talking about some crazy stuff here, but I think the fact that because my nerves were misfiring due to the fact of the lesions and whatnot, I was getting access to other parts of my brain, because we supposed to only be using 10%, and and I think that's the reason for me seeing those things. I don't see them as much now since my lesions have been less active and are not active at all. Something bad has to be coming in order for me to see something, and I don't really see anything too much. I get that intuitional feeling, and it never fails. But yeah, it says it basically states to go back to the thing. It's easy to assume that people with a chronic illness like MS will inevitably become depressed. This is incorrect. Assumptions relies on the idea that depression is a reaction to MS. While this is possible, recent research has discovered that depression may also be a symptom. which a lot of us already know that. A lot of us wasn't depressed at all because we were living a high life. We were living a life, what? We was killing it, and then all of a sudden, we fall, we get numb, we become paralyzed, we can't see, and then we get diagnosed with MS, and then we get depressed. I better play the lotto. I just saw that. I can't come up with numbers like that. It states how to address MS-related depressions. Depression, together with anxiety, may worsen thoughts of suicide and shouldn't be left untreated. In most cases, it can be effectively managed with the combination of antidepressant and cognitive behavioral therapy. This type of therapy focuses on identifying and shifting thoughts, beliefs, and behaviors that may contribute to emotional distress. Now, let me go and say, I don't want to push antidepressant on anybody. So let's push antidepressant over to the side. We don't want to talk about medication. But what we do want to talk about is cognitive behavioral therapy. This type of therapy focuses on identifying and shifting thoughts, beliefs, and behaviors that may contribute to emotional distress. That's what we are needing to do when it comes down. You have to reposition thoughts. Why am I dreading the fact that these people don't like me? What can I do to make these people like me? So once you start feeling like that and you get deep into trying to make someone like you when they're not going to like you, they're not going to understand you, you're hurting yourself, basically. That's what it boils down to. You're hurting yourself. And especially like in a relationship, you can't change somebody that doesn't want to change. You can sit up here and tell them what you want from them, and if it's been 15 years and they still ain't did it, they're not going to change. It's possible that they're never going to change. There's something going to have to happen for them to change, and obviously what you're doing ain't changing it. So, but it's hurting you. Yeah, and that's the thing. Antidepressants are supposed to be for depression, but it sits and tell you that side effects might get depressed, suicidal thoughts. Dude, you're supposed to be curing me from depression. Why do I want to kill myself? As a matter of fact, I wasn't even thinking about killing myself. I was just sad. I was just down. Now I'm popping this medication, and now I'm trying to... So, yeah, push that out of the way. We don't want to talk about antidepressant. What we want to talk about, taking ownership of the fact that, especially if you did something wrong yourself, you got to just go ahead and swallow that. You messed up. Don't let it ruin your life, man. There's nothing, especially if it's just something that you just did it. You can't go back in time. You just gonna have to face that crap. But then if it's something somebody else is doing, I'm not saying don't be depressed about it. I'm not trying to say don't allow it to hurt you, because everybody's different. Like, I allowed that to hurt me this weekend. It hurt me to a certain degree, but then I realized that. And I knew if I harped on it, if I stuck with it, if I kept it in, if I still allowed it to grind at me, I'm more likely, I wouldn't be talking to you guys right now. I'd probably be in the hospital somewhere. That's how mad I wanted to get, but I knew it wasn't no reason for it. Why? And when I realized me trying to figure out, can you better help me understand why you feeling this way? And they couldn't tell me or quote unquote give me a legitimate reason. I just had to back off from it, and you're going to feel the way that you're going to feel. I can't change that. Regardless of what I say, regardless of what I do, you're going to feel that way. So it's just best for me to walk away from the situation. So yeah, And the other thing was anxiety. Approximately half of people who have MS and depression also experience anxiety, but anxiety can also occur independently without depression. Anxiety disorder are 3 times more common in MS than in the general population. Anxiety has been linked to the decreased social interaction, increased risk of excessive alcohol use, increased levels of pain, and may even impact cognitive skills such as how fast your brain processes information. All right. Causes of MS related anxiety. When it comes to living with multiple sclerosis, anxiety often stems from the uncertainty over what the next day will bring. So you know a lot of us suffer more with anxiety than it is depression. In relapsing remitting MS, the flare-ups can occur unexpectedly. You never know if there is going to be an exacerbation, how severe the symptoms will be if a flare-up occurs, or if MS symptoms will progress over time. It can be difficult not to worry, especially if you have many responsibilities around caring for your health, family, or children. So, I'm going to end it off with that, and I'm finna close it. When it all boils down to it, guys, depression medicine is it's good Christian brother. When it all boils down to it, guys, is we have more control over how we feel than you think. You might not believe it. You might not want to believe it. You have more control over how much MS is going to take you down than you feel, than you know. Regardless if your body is shutting down on you, still you have more control than you realize. And when we start realizing that we do have more control, that if we be more proactive on trying to find something that can put us in a happy spot versus trying to figure out why I can't. That's just like when you were a child and your parents, where certain parents used to tell you, I don't want to hear that word. Get that out of your vocabulary. I can't. Yeah. You might not be able to walk at the moment, but is that stopping you from doing something else? Is that stopping you from thinking positive? Is that stopping you from being optimistic? No, that it is not. You choose not to be optimistic. We all choose not to be optimistic because we're not our old self anymore. We are choosing that. The doctor is not doing it. Our spouse is not doing it. Our partner is not doing it. Our friends are not doing it. We are choosing not to be optimistic about doing something else or trying to go out to bring some happiness in ourselves because we're harping on the fact that we're not who we used to be. And some of us, I'm going to go ahead and say it, some of us could have been pricks. Some of us was pricks. But since we've been diagnosed with MS, this is the best person that we've been in our whole entire life. I wasn't a prick, but I can sit up here and say this has been the best me that I've ever witnessed in my entire life. I am 38, finna be 39 in January. I can sit up here and tell you up front and throw myself up under the bus. I was a mental wreck. I was depressed. I didn't have no confidence. I was getting bullied. I had issues. I was hitting my head upside the desk. Like I stated, I was the reason why I end up with MS. I used to run into trees. Now, back then, I was looking for attention because I wanted friends. Now, I can care less if you want to be my friend. I'm not talking about you guys. I love you guys. I like that you guys are my friends. I'm not talking about you, so don't run, please. I'm talking about the people out there. I can care less. I have nothing to prove to these people. And you guys don't have anything to prove to me, let alone do I have anything to prove you. That's why I am who I am. I'm going to make mistakes. I'm possibly going to say things that might piss people off. If that is the case, you tell me so I can let you know if I meant what I said, or I can sit up here and say something. What caused cancer? Oh yeah, Ocrevus can cause breast cancer. I'm on Ocrevus myself. It can cause breast cancer. I'm going to get my treatment in January, but I don't know if I'm going to get it though. I'm not sure. I haven't made up my mind. But guys, with that being said, I know I didn't have a guest up. I didn't bring anybody up. I just felt like there was a lot of stuff that I wanted to say. But if you guys know of anybody that's a caregiver or your partner is willing to come and watch the show Friday and wouldn't mind telling that their side of the story of what they're going through, by all means, Friday, 7 o'clock, Fierce Friday is on. I'm still going to talk about it. I'm still going to bring the topic up. And we're just going to go from there. If somebody shows up, somebody shows up. If not, okay. But you guys can still comment in this. You can always do that. If you see a comment that somebody said and you want to go back and say it, yeah. If you didn't see all of it, please go back to the beginning and watch it from the beginning. And with that being said, guys, because I got to get up early in the morning and go to work, which I possibly might have to walk. Yeah, I need to go and call it a night. So, love you. And with French, j'aime. Peace, love, happiness. Same place, same time next Friday, babies. Bye. And I keep doing this salute thing like it's cool or something. You know, y'all can tell me that it's not cool. I'm not gonna feel bad. You're not gonna hurt my feelings whatsoever. Bye.